Hello, my name is Arya Ramachandran. I am from Winchester, Massachusetts. Today I have the distinct pleasure to be here with Dr. Mistry, who's a pediatric, he works in Boston Children's Hospital as a pediatric critical care physician who works in the Department of Cardiology. Dr. Mistry, could you please provide a brief introduction about yourself?
Sure, and thank you again for inviting me to join this discussion. I am a pediatric critical care physician in the Department of Cardiology at Boston Children's Hospital. Boston Children's Hospital actually has the largest pediatric heart center in the country and likely one of the best known in the world. I work specifically in the cardiac intensive care unit of the Department of Cardiology. What that means is I take care of children who have heart disease, who are critically ill and need to have intensive care unit therapies and monitoring.
Okay. Now, how have your patients been specifically impacted by COVID?
That's a great question. What we know from the worldwide experience as well as from the United States is that individuals who have other medical problems, such as high blood pressure or diabetes or lung disease, for example, from smoking for many years, have an increased risk of having more serious complications of coronavirus. So the concerns we have for the patients that I take care of, those that are either born or acquire heart disease, is that they are a population that's vulnerable because they have a medical problem that could put them at increased risk for those serious complications.
Okay. So, yes, so you just previously mentioned how people with pre-diagnosed conditions might have a more serious case of coronavirus. Now, how different are the treatments with people who have had a pre-diagnosed or a case of anything else with
Sure.
who now have COVID?
Mhm. And so the differences in treatment in part relate to how severe the illness would be. So for example, we still know that about 80% of individuals who are positive for coronavirus infection may have a mild to moderate symptoms, and the treatment for those may actually be just more supportive, either treating the fever, treating the aches and pains, staying at home, taking rest, whereas those that have medical problems may have more severe complications. And what we have seen is that, for example, people who have lung disease, for example, asthma or lung changes secondary to smoking, have more severe respiratory symptoms. And so they may require not only being in the hospital, but then also being in the intensive care unit. And then, as we've seen on television quite frequently, requiring a ventilator for support.
Sure. So, as a pulmonary critical care specialist, what is the procedure to differentiate between COVID patients and flu patients?
That's a great question. And that's one of the most difficult things with regards to COVID-19 or coronavirus infected patients is that a lot of the symptoms that you see at the beginning are often the same. So upper respiratory symptoms such as the cough or runny nose, a fever, those are things that are common both for the flu and coronavirus. What we have seen for coronavirus, though, is that in those that are increased risk for complications, that can proceed to more severe forms of pneumonia. And then once those severe symptoms begin, they may also have other organ dysfunction. So for example, not only the lungs, but the kidneys could also be infected, or there may be a small percentage that have heart function that's affected as well. And so at the beginning, it's often difficult to distinguish between flu and coronavirus, but we do know that flu also can cause these symptoms as well, which is why anybody who has these symptoms are treating as if they have coronavirus until the test comes back positive or negative.
Okay, so what do you do with the children who are waiting for their test results? Because there is a chance that they, of course, do not have the virus.
Yes, and that's a great question. And so there are several things that we've done here. One is that, for example, for children that I have taken care of that we thought perhaps would have coronavirus or COVID-19 positive status, we've treated them as if they would. So what does that mean for us in the intensive care unit? That means, one, they're placed in a room that's specialized, meaning that there is what's called a negative pressure room. So in those rooms that have four walls and four sides to it, so as a door, it's not an open bay, that the air from there is essentially vacuumed out and filtered to remove the virus particles. So none of the air from that room actually makes it to the rest of the intensive care unit.
Okay.
Second, we are wearing the positive protective equipment that you hear about frequently with those patients. So that's eye gear, mask, N95 mask, gown, and gloves. And so those are the things that we're doing on every patient until we know their status.
Now, with those rooms, the special rooms that filter out the air, of course, well, how many rooms do you have, and is that enough for the amount of patients that you are getting?
That's a fantastic question. And so that actually even is a bigger question in that how many intensive care unit beds in general do we have? And we know that that's been the challenge for many countries around the world. Italy, for example, we hear a lot about, and New York and Manhattan specifically is what we hear about more recently. And so at the moment, Boston has done a very good job in managing what we anticipate will be a surge rather. And so that we have both adult intensive care unit beds, but also pediatric intensive care unit beds. And so, for example, at Children's Hospital, we have reduced or canceled a lot of elective surgeries that may have taken those beds, anticipating that if there's a large number of patients that come in, adults or children, that we can use these beds for those types of patients.
Okay. I've also heard that Boston is planning on turning the Boston Convention Center into a 1,000 bed field hospital. Now, could you describe to me, I don't know if you know much about this, given that it might not be part of the Boston Children's Hospital, but could you describe to me what's going on in that situation?
Sure, and as you mentioned, I'm not familiar with all the specifics of that particular effort, but it is probably similar to the other places you've heard around the country where they make a makeshift hospital, and that provides a couple of advantages. One is it's a large area in which a large number of beds that may not be available in the current hospital structure. Two, it allows to cohort or bring together patients who may be COVID-19 positive. So that way you're not going to spread the coronavirus to other patients who may be vulnerable as well. And third, it also allows you to create a core group of medical providers. And that's the other thing we've been doing in the Boston hospitals, is that trying to come up with models is how can you limit the exposure of physicians and nurses and other healthcare professionals to the coronavirus, and having a field hospital like you described would allow that. Because as you know, the other patients who get sick for other reasons continue to happen in the background while the coronavirus is continuing to spread.
Okay. Now, what is the difference in symptoms between a child fighting the common flu versus the novel coronavirus?
That's a great question. So for children specifically, we do know, unfortunately, that coronavirus does not tend to have a severe or even sometimes a moderate course for children. So for children specifically, the flu and the coronavirus may actually look exactly the same. Sort of mild symptoms of a runny nose, a cough, a fever certainly is one of the more common symptoms of both coronavirus and the flu. And so for children, we are fortunate. However, those that are older, you may start to see more of those serious complications I talked about before. What is worth noting is that when we talked about the experience in China and in Italy, we often talked about the high-risk patients being above 70 or 80 years of age. What we're seeing in the United States, and certainly in the Northeast and in Boston hospitals, is that some of the more severe complications are now occurring in the younger age demographic. So for example, individuals who are 50 or 40. And while that may not seem young to you, it certainly is much younger than those that are 70 or 80.
Yeah.
Again, those are patients who have other medical problems. But again, we're starting to see that in that younger age bracket. But again, we are very fortunate that even worldwide, not just the United States experience, children, so let's say less than 18 years of age and certainly less than 10 years of age, have very mild, if any, symptoms associated with coronavirus. So we're very fortunate for that.
Yes. Now, what percentage of total patients are COVID compared to other ailments?
So for example, the flu, is that?
The flu or any other anything else that you have to treat in the hospital during this time.
Sure, exactly right. So the absolute numbers at the moment, so for example, Massachusetts, according to the Department of Public Health for Massachusetts, this week suggested that the number of COVID positive 19 patients is around 28,000 or so, right? If you compare that to the flu, certainly there'd probably be on a year-to-year basis, many more individuals who are positive for flu than they would be for coronavirus at this stage. But the worrisome part here is that how quickly coronavirus is spreading despite our efforts. And also this is a new or novel virus to us. So while we know the flu is seasonal, meaning as the weather gets warmer, the flu tends to go away, we're still uncertain as to whether coronavirus will do that or follow that trend.
Sure. Now, are children faring better than older people? And I mean, I know you've said kids under 10, but how are more specifically teenagers doing with this
That's a great
virus?
question. And when I think about children or talk about pediatrics, I'm often thinking about less than 18 years of age. That's
Okay.
often the age cutoff that we think about adults. And so while I mentioned 10 years old earlier, certainly those that are less than 18 or 20 years of age in general
Mhm.
have fared much better than those that are older than that age bracket with regards to coronavirus. So again, it's still uncertain as to why that may be the case, but certainly teenagers, like you've asked, or even those that are younger than teenagers, have done relatively better than the older population.
Okay. Now, how does isolation work in BCH, Boston Children's Hospital? And do you have a separate unit for COVID patients from other patients?
It's a great question. And so often the isolation strategies we're using are ones that are used not only in the Boston area hospitals, but across the country and the world. And what we know is that the virus itself is spread by respiratory droplets, as you most likely know,
Hmm.
hence the recent emphasis on wearing masks.
Yeah.
And so the the personal protective equipment rather that we utilize for every patient is the gown and the gloves and the eye gear and the mask. What's also important though than just wearing the PPE is knowing how to take it off and put it on without contaminating yourself. So Boston Children's Hospital and other hospitals have done simulation with high fidelity mannequins to practice taking off this type of equipment. Because if you can think about it, if the virus is on the outside of, let's say, my mask or on the outside of my gloves, when I'm taking them off, I certainly don't want to get that on myself so that when I touch something else, I would then make that an area where the virus particles are living. And so part of the isolation is not only using the equipment, but practicing how to take it on, put it on and take it off properly. And then the other isolation techniques are just specialized rooms where we can control which direction the airflow is.
Okay. Now, so you're in a special situation given that you're on the front lines fighting this virus. So how are you protecting your immediate family given your special situation? And how's your family adjusting? Um, yeah.
That's another great question, in part because we often talk about what's going on at the front line, like you said, at the bedside. But what happens when medical providers like myself come home?
Mhm.
And so part of it is that we've changed our technique on how we even enter or exit the hospital. So for example, I will wear my regular clothes to work. I immediately put on a mask once I enter the hospital. Once I get to the area near the intensive care unit, I change into hospital issued scrubs. I do my day-to-day work when it comes to patient care. And then I take those scrubs and change back into my street clothes and then leave the hospital, theoretically leaving any contaminated clothes or scrubs at the hospital. But it doesn't just end there. And then when I come home, for example, for myself, I come through a door that's near our laundry area. I take off my clothes, I put in the laundry, I leave my shoes down there, and I quickly take a shower. Those are the strategies I'm taking in order to protect my family from
Mhm.
potential infection from the hospital. Now, that is also not just specific to COVID-19. We often do that, for example, like with the flu season or
Mhm.
any other sort of infection that's
Okay.
similarly spread.
Have you noticed yourself isolating or have you noticed that you've been isolating yourself from your family more due to this virus, or is it still all as usual at the household?
That is another fantastic question because that is what we have found is that a lot of the discussion amongst healthcare providers is how do you keep your family safe? And so in addition to the techniques I just mentioned before, we are fortunate that, for example, my in-laws have a farm in Gettysburg, Pennsylvania. And so we've talked about, is it better for my wife and my kids to be at the farm in Gettysburg, Pennsylvania, while I'm doing work at the hospital? So even when
Mhm.
I come home and I do all the strategies I just described, I'm not potentially putting them at risk. And so it has changed the dynamics as to how we maintain close proximity to each other.
Sure. And I actually think this is the perfect moment to highlight how, especially because your children are young, so it's a perfect
Yes.
moment to highlight how it could be difficult being a doctor and managing a family. So it really shows how people on the front line are truly sacrificing. So thank you so much.
Thank you.
Yes. Now, next question. So I've heard that ER visits for non-COVID patients have dropped. So do you think that this is because there are fewer accidents due to the social distancing, for example, last go school or play dates, or are patients not coming because they're scared of getting contaminated with the virus?
It's without looking at the data specifically, it's hard for me to say, but I can certainly give you my thoughts on it, which would be that this time of year, often emergency department visits, certainly for children, is related to flu-like symptoms or respiratory illnesses. And so what we're seeing is a decrease in those numbers. And part of that is in part for the social distancing that you described, is that as opposed to exposing either a parent or a child to potential coronavirus in the emergency department setting, people are electing to stay home and treat them supportively. Of course, if there's any need for hospitalization, they're asked to certainly come straight to the emergency department or call 911. But I think that is part of it, is the social distancing aspect that you've described.
Okay. So, what about children with broken bones or a sprained ankle or something? So, do those go to phone appointments or go to basically online appointments? And is that why there perhaps have been an uprising in online appointments?
It's a great question. So, the things that would be amenable to using virtual or telehealth type of modalities are things that you can describe the symptoms over a camera.
Okay.
And actually talk with the person. So for example, going back to your earlier question, if you can talk to an emergency medicine physician or one's pediatrician and say, these are the symptoms, what do you think's going on? I may be able to give you advice and you can stay at home. For things that require treatment by a physician in the hospital, a broken leg, for example, that would need an orthopedic surgeon to take a look and perhaps put a cast, that would require a visit to the hospital. But to your point or question earlier about isolation, a lot of the hospitals in Boston, certainly across the country, are using different triage techniques to keep patients who may have COVID positive 19 status or other respiratory illnesses like the flu separate from those that actually have other non-respiratory illness injuries, for example.
Okay, so well, this is the final question. So do you have any parting advice for children or parents?
I think the advice that I would give would be the ones I think that we've heard a lot from the Department of Public Health, both Massachusetts and the federal level. We certainly hear about the coronavirus briefings every day. I think good hand hygiene, which is good not only for coronavirus, but during the flu season in general. And so a lot of this isn't any different than, let's say, last March or April when we were dealing with the flu, which is washing your hands frequently, using hand sanitizer when soap and water isn't available to you, the social distancing, which is quite difficult as we get further and further along in social distancing. I think a lot of us feel sort of trapped inside or in a limited yard space. Certainly in the city of Boston, it's not as if everybody has acres of land to run around on. And so I think that'll become even more important to remind ourselves of the social distancing. We've heard recently from the CDC about potentially using masks when going on public, and that's important. We obviously have to go to the grocery store, for example. And so while we try to limit our distance or close proximity, it may not always be possible. So again, using a mask may be helpful as well. But again, listening to our public health officials is probably the key point with regards to advice on when to go back and the social distancing strategies.
Okay. Well, thank you so much for being here, and thank you so much for your excellent answers, because I'll tell you this much, I learned something from this interview.
Well, thanks for having me.
Of course, thank you for putting your life on the line to save others and being on the front lines trying to stop this virus. We really appreciate that.
It's a team effort, and certainly it's a lot of people working together to beat the coronavirus sort of pandemic.
Okay, well, thank you.
Thank you.